Director Curry is absent. Vice Chair Deere.
Deere is here.
Director Garza.
Present.
Director Guggenheim.
Present.
Director Harrington.
Present.
Director Kim.
Present.
Director Ketting.
Present.
Director Munar.
Present.
Director Prendergast is absent. Director Ryder is absent. Director Story
Present.
and Chair Taylor.
Present.
You have a quorum.
Thank you. Pursuant to the Illinois Open Meetings Act, meetings held remotely will require roll call votes for all action items. To streamline, we'll combine the action items into a combined motion. Meetings of the CCH board and its committees will be held remotely until otherwise noticed due to the termination of the public health emergency exists. The next regular scheduled meeting of the board will be held Friday, June 24th, at 9 a.m. The first item on today's agenda is employee recognition, which will be reviewed by Mr. Rocha or Ms. Amos.
Good morning. It's Dr. Fegan. I'm doing employee
Okay,
recognition
there you go.
today.
Thank you, Dr. Fegan.
Okay, so I'd like to congratulate Cook County Health physicians, Dr. Larissa Unruh, and who's the chief resident of emergency medicine at Stroger Hospital, Dr. Sadhana Dampuri, and who is attending in adolescent and young adult medicine at Stroger and Provident, and Dr. Kenneth Soyemi, who is our medical director for the Cook County Juvenile Temporary Detention Center. They published a paper in PLOS ONE, a premier open access peer-reviewed journal published by the Public Library of Science, and the article on health disparities and COVID-19, a retrospective study examining individuals and community factors causing disproportionate COVID-19 outcomes in Cook County, Illinois. It was released this month and provides important data and commentary on the need to broadly address issues of health equity. The researchers found that race is a significant factor in COVID-19 related mortality in Cook County. And the data indicate that many of the deaths were not inevitable, but were byproducts of an ingrained structural inequality resulting from diminished opportunities for our patients. We hope that the lessons from this study can help illuminate the persistent inequalities in our country so that as a society, we can better address these issues going forward. So we wanted to congratulate these physicians on this scholarly work that was published, and they continue to represent us well.
Thank you. Well done.
And then going further, okay, Debbie, you skipped on me, but I'll come back to the others. Cook County held its annual Nurse Clinical Excellence Award ceremony on May 13th, and several Cook County Health nurses were honored for their contributions to Cook County and beyond. And so we want to congratulate those winners. So they were in leadership, Blaine Stringer from Medical Surgical Nursing, for volunteerism, Joyce Nguti from Emergency Services. For a rising star was Anu Thomas from General Medicine Oncology Unit. For community care, it was Martia Brown. Clinical nursing was Regina Lapsovic. And education and mentorship was Cheryl Eady. Correctional health was Augustus Alabi. And for patient care support, Rosemary Salas. And now I'd like to come back to thank you, there we go. So we have Cook County has a long standing reputation for excellence in medical research and innovation, which was on display this month at our Institutional Research Day. And so physicians across a multitude of specialties highlighted their research projects, and the winners were selected by a multidisciplinary committee. So we want to congratulate the winners. Dr. Daniel Riggins from Internal Medicine, Dr. Preston Benab from Surgery, Dr. Viviana Barquette from Surgery, Dr. Teresa Evans from Trauma and Burn, Dr. Dae-Young Park from Internal Medicine, Dr. Maha Elisbre from Internal Medicine, Dr. Ufuk Vadar from internal medicine, Dr. Antonia Nemanich from emergency medicine, and Dr. Jenny Hua from internal medicine. And I also at this time want to thank the Research Day Committee for their time and effort, because it takes a lot to put this together and then to make sure that the judging occurs. And so that includes Ms. who is our librarian, Dr. Stephen Axe from emergency medicine and toxicology, Dr. Michael Hoffman from internal medicine, Dr. Julie Nowinski Konchak from preventive medicine, Dr. Kathy Rezai from infectious disease, Dr. William Trick from our collaborative research unit, Dr. Elena Gonzalez from dermatology, Dr. Jenny Hua from preventive medicine, Prasance Ligamenti from internal medicine, Rochelle Rennie from family medicine, Hafiz Shaka from internal medicine, and Eric Christian from emergency medicine. So they put a lot of effort into this research day, and the physicians come up with a lot of good papers and poster presentations. So we just want to take a moment to acknowledge this event, which leads to the articles that I talked about at the beginning.
Thank you. The next item is a board resolution celebrating CCH's community vaccination program. Madam Secretary, will you please read the resolution into the record?
Whereas Cook County Health, CCH, has a 185-year history of caring for all residents of Cook County, regardless of ability to pay. And whereas CCH remains at the forefront of responding to the COVID-19 pandemic, the most devastating public health emergency of our time. And whereas CCH is dedicated to providing equitable, high-quality medical care, education, and resources for all residents throughout the pandemic. And whereas when the first COVID-19 vaccines became available, CCH committed to providing broad, equitable access to vaccinations. And whereas COVID-19 vaccines are safe and were developed based on decades of scientific research. And whereas getting vaccinated remains the easiest and most effective way to protect yourself and those around you from infection. And whereas a recent study from the U.S. Centers for Disease Control and Prevention found that even during the Omicron surge, a primary series of an mRNA vaccine was 79% effective against serious illness and death from COVID-19, and that increased to 94% effective if the individual received a booster shot. And whereas CCH administered its first dose of COVID-19 vaccine on December 11th, 2020, and whereas just weeks later, CCH was preparing to stand up its first community mass vaccination site, and whereas in all, CCH opened 6 mass vaccination sites across Cook County that could each accommodate up to 4,000 people a day. And whereas CCH also offered vaccinations at Stroger and Provident hospitals, its community health centers, correctional health facilities, and at pop-up events. And whereas Cook County government, CCH, which includes the Cook County Department of Public Health, CCDPH, launched My Shot Cook County, an award-winning omni-channel public education campaign that provides accurate, understandable information about COVID-19 and vaccination to Cook County communities, generating more than 101 million overall impressions. And whereas tremendous efforts were made to reduce barriers to vaccination at CCH locations, including welcoming walk-ins, expanding vaccination clinic hours, promotions for essential workers, and incentives to make getting vaccinated as easy as possible. And whereas, in collaboration with community-based organizations, a hyper-local vaccine equity strategy was employed to reach individuals who remained unvaccinated and to bring information and vaccine access to them in the communities where they live and work. And whereas, the week of April 24th, 2022, CCH administered its 1 millionth dose of COVID-19 vaccine. And whereas CCH is among the first health systems in the country to achieve this level of success in vaccinating its communities. And whereas providing this number of vaccines has undoubtedly saved lives, prevented catastrophic illness, and kept families whole during the pandemic. And whereas this milestone would not be possible without the incredible hard work and dedication of CCH staff, including CCDPH, President Preckwinkle, the Board of Commissioners, and our partners at Cook County Government, Governor Pritzker, the State of Illinois, the Illinois National Guard, local municipalities and officials, and community-based organizations. And whereas CCH and its partners remain steadfast in their commitment to continuing to provide widespread, equitable access to COVID-19 vaccines as we continue to fight this pandemic. And now therefore be it resolved that the Board of Directors of Cook County Health does hereby gratefully acknowledge the entire Cook County Health team for their incredible contributions to administering more than 1 million doses of COVID-19 vaccine and for their ongoing work at the front lines of the COVID-19 pandemic.
Chair Taylor, you're muted.
Tried it. Thank you. Well done. The next item is public testimony. Madam Secretary, do we have any written testimony that was submitted to be read into the record?
We did. We received 8 testimonies. The first testimony is from an individual identified as AK.
I'm a medical ICU nurse and have been at the front line of the designated COVID-19 unit throughout the pandemic. In the Chicago Tribune on May 25, Cook County Board Commissioner Stanley Moore was quoted saying, "I love my job, and in order for me to keep it and to concentrate on it, I have to make a decent salary." Commissioner Moore, I can't argue with that sentiment. I feel exactly the same. You felt that it was the right thing to do to increase elected officials' 6-figure salaries by an impressive 10%. What I want to know is, where is the same energy when it comes to the frontline nurses who have been facing enormous stress and danger throughout this pandemic? We've been coming to you for 5 months now saying exactly the same thing. We love our jobs, and in order for us to keep them and to concentrate on them, we have to make a decent salary. We're doing work that is highly skilled as well as physically and psychologically demanding. We're dedicated to Cook County, or we would have already left to high-paying agency jobs as so many of our former coworkers did. We love our jobs, but in order for us to keep our jobs and to concentrate on them, we need to make a decent salary. Commissioners of the board, you voted to do the right thing for yourselves. Who's going to do the right thing for us?
The next testimony is from Barb O'Brien.
My name is Barb O'Brien, newly elected NNOC Chair of the Professional Practice Committee, PPC, for Stroger Hospital and County Care, Integrated Care. I speak on behalf of all nurses in these affiliates. We want to offer our congratulations on your most recent vote to increase your compensation by 10% with built-in increases to occur annually. Kudos for also ensuring that your annual increases occurred indefinitely. We also want to extend our sympathies for the ways in which you all have suffered during your tenure as commissioners. Having to remove your children from private school is egregious, not to mention the fact that you attend numerous virtual meetings from home. Your sacrifices have not gone unnoticed. While you are relishing in the victory of the 13-4 vote and the additional 10%, let me remind you of the proposal for retention benefits that has gone unaddressed since January 2022. NNOC nurses have asked for retention pay, incentives to pick up extra shifts to help with the staffing shortage, and the security of knowing that when, not if, they get COVID again, their employer will provide COVID sick pay. We've been waiting for over 5 months. And while we've been waiting, CCHHS leadership has requested millions of dollars to renew agency contracts. There are closed sessions to discuss the incentive package for the CEO. County Care continues to enroll thousands of members, equating to thousands of dollars. AI firms are hired to the tune of $18 million, while nurses are written out of the budget. A new CNO is hired, and county commissioners' compensation increase. What about the nurses? We are tired, we are burnt out, and we are urging you to answer and vote on our proposal just like you did for yourselves.
The next testimony is from Barbara Kochmar.
My name is Barbara Kasmar, and I have worked at Cook County Hospital for over 21 years, and sadly I can see how nursing morale has decreased over time due to lack of appreciation from management for our loyalty and hard work. Over the last few years, many CCH nurses left early before their full intended retirement, not only because of COVID, but the lack of support from management and zero appreciation for their years of hard work for our institution, which is vital to our community. When CCH nurses were asked for COVID differential pay, after putting up a long fight, we were awarded $5 per hour for approximately 2 months, while other hospitals were retaining their nurses with bonuses, extra pay for OT, and other incentives. We CCH nurses are shocked that administrators are able to pay nursing agencies this huge amount of money, tens of millions a month, and not making efforts to hire new ones or retain experienced CCH nurses. Can Cook County taxpayers afford this?
The next testimony is from Consuelo Vargas.
My name is Consuelo Vargas, and I worked in the ER at John Stroger Hospital from 2014 to 2021. I was also the chief nurse rep of the health system as a member of NNOC. I've always said to those in upper management that a Cook County nurse can go find work anywhere, but many of the patients we serve cannot find health care anywhere. I worked for other hospitals where I saw what happened to people when they didn't have insurance or the right kind of insurance. I didn't need to look at charts or graphs because I saw what those numbers represent. They represent people. So when I came to county, I felt proud to work at a place that didn't treat those seeking care as a burden to their bottom line. What I have seen is how poorly the RNs are treated, and it has gotten worse since I left. As RNs left, management acted as if it didn't matter. A nurse is a nurse is a nurse was the attitude. The RNs are not seen as valuable, so more and more nurses left, and more will leave. So who will be there to train up-and-coming RNs? It takes somebody who is all into work at CCHHS with their skills, compassion, and heart. Someone who is willing to take the time to understand and meet a patient's needs based not only on their complaint, but the barriers they face because of their socioeconomic status, language, and stereotypes placed on them by society. My decision to leave was not an easy one, and it lays heavy on my heart to this day. I did not leave to take a high-paying agency position. I left because I could not leave work feeling disappointed in hospital leadership every single day. Your nurses are breaking, and I can attest that the healing takes a long time if their wounds heal at all. Today, you have the opportunity to stop the hemorrhaging of RNs from CCHHS. Nurses have been telling management how to make things right, and today the RNs are coming to you. For some, you are their last chance, the last opportunity, the last try before they make a decision to stay or leave.
The next testimony is from Falguni Dave.
My name is Falguni Dave. I'm a nurse working in the COVID medical ICU at Stroger Hospital. I want to say that working during a pandemic is nothing short of a real-life nightmare. The pandemic itself has crippled the healthcare field. We are losing nurses due to the long-term effects of COVID, burnout, and most importantly, due to the lack of respect for the profession of nursing and being devalued as staff by our employers. This current surge has made staffing critically short. On top of working drastically short during this pandemic, we are being told by Stroger Hospital and its leadership that if we get sick with COVID, we will have to use our own earned sick time and vacation time to cover our loss in pay while we recover. If a nurse does not have any time left in those two banks, then they will consider evaluating our individual case and see if we qualify for any additional time. So if I'm the only one who is earning a paycheck for my family and I fall sick due to COVID while I was taking care of your loved one, then my family will suffer because I do not have any time in my PTO bank to cover my loss in pay. So that means I may miss my rent or mortgage payment. I may not be able to provide food and or medicine for my family. This is all because Stroger Hospital and its leadership do not think that I and my fellow staff nurses at the hospital need the separate COVID time off they are obligated by OSHA to provide to their employees, which is needed to give nurses peace of mind knowing that if we get sick while caring for your family, we are in turn covered regardless of having any paid time off in our bank, and that we will be able to take care of our families as well. This failure to meet our basic needs as frontline patient caregivers in a pandemic underscore how devalued our nurses are right now. Where's the outrage? For the nurses who haven't caught COVID yet and are still able to work, we don't have enough staff on a regular basis to meet the needs of COVID patients. The highest levels of nursing administration are being pulled to the floor to meet the needs of a very sick COVID-positive patients who require proning, a life-saving technique that requires a full team of healthcare staff to complete. Patients are coding, nurses are leaving their staff jobs and participating in the growing churn of bouncing from one understaffed, disrespectfully run hospital system to another, leaving a wave of underpaid staff nurses behind them who train them during their short stay while making thousands of dollars less. We need to bring dignity back to the profession of nursing as a career, not a contract. We do that by telling our fellow RNs, join or form a union, by telling our allies, support our demands locally, by writing your elected officials and following public health guidance to keep our hospital admissions maintainable, and by reminding all that safe nurse-to-patient ratios save lives. It is staff nurses who demand and in real time enforce safe staffing and patient advocacy at the bedside. Support us. Why do the county commissioners and the board think that you all deserve a 10% raise with a built-in 3% annual across the board increase every year until someone had the brains to appeal it and give it back to the nurses? Let me get this straight. The work and sacrifice of county nurses throughout this devastating global health crisis has gone unseen and unheard. The fact is, we were and still are the ones contracting COVID at work. Many nurses have become disabled, many nurses have lost their lives, and many, many more brought COVID-19 home with them, infecting their loved ones with no ability to stop the constant exposure because we are county nurses. While this was happening to us, you all sat in front of a screen, and you are still sitting in front of a screen in the comfort of your own homes or offices to perform your jobs. Somehow, you all believe that you deserve a raise and a salary comparable to those that work in similar jobs to you in government relations. You believe this while Cook County Health nurses make the lowest wages by comparison to other hospitals, including two directly across the street from Stroger. We would have been offered no retention bonuses, extra shift incentives, or any form of compensation that would lead to a nurse, the most important part of keeping our healthcare system and patients alive, feeling respected and valued in a pandemic. County nurses did not receive any substantial amount of money for COVID ever. Even when the federal government gave out so much money to the states, and Cook County received a large sum of the state's federal money for COVID response, you spent it all on grossly overpaying temporary, short-term agency nurse contracts, and we county nurses had to train those nurses in a never-ending cycle that threatened our patients' quality of care every day and still does. You keep approving more and more money for agency contracts each month, $35 million last month. That is disgusting when you don't even consider continuing to provide COVID relief pay when we contract the virus over and over at work. You make us use our sick time until we run out, and then you discipline us like we can help being nurses in a pandemic. You fill your pockets with taxpayer money and give none to your nurses who have worked themselves to death during the pandemic. We deserve more, and we deserve answers to our concerns and transparency on how and where all the COVID relief money went that was meant for the true frontline healthcare workers. NNOC RNs demand retention compensation before any member of this government dare approve their own ballooning bank accounts from their comfy office chair.
The next testimony is from Tasha Mosley Brown.
My name is Tasha Mosley Brown, newly elected NNOC Chief Nurse Representative for Cook County Health and Hospital System. I speak on behalf of all nurses within the system when I say that we are appalled to learn that as of 5/24/22, the commissioners voted 13-4 to increase your compensation for elected officials by 10%, starting with the new term beginning this December, with increases of up to 3% scheduled annually after that. Yet, our proposal for retention benefits remains on the desk, unanswered, collecting dust since January 2022. In addition, leadership has requested millions of dollars to continue onboarding agency staff to supplement staffing within our system. During the month of May, CCHHS celebrated Nurses Month. Nurses are not interested in being gifted backpacks, ice cream socials, paper certificates for our services, and Zooms that teach us wellness tips. Submitting testimony is getting old, and nurses are fed up, overworked, and just tired. Nurses want to feel appreciated by having our proposal answered, voted on, and passed by a unanimous vote, just like the commissioners passed for themselves on 5/24/22. My hope is that this is the last testimony written on this subject matter.
The next testimony is from NNOC registered nurses.
The leadership of Cook County government approved automatic annual increases for themselves this week in May of 2022. In the Chicago Tribune on May 24th, reporter Alice Yin wrote that the 17 Cook County commissioners and board president Preckwinkle approved a significant and indefinite gain to their salaries. County Board President Preckwinkle has shamefully told registered nurses working at Cook County Health that having approved the operating budget for the fiscal year, there is no money available to compensate their healthcare staff. The county has told nurses that they can't provide them retention compensation after surviving the COVID-19 pandemic because they would have to give it to everyone else. It is strange that in the circumstances facing our communities, the operating budget can indefinitely sustain the burden of elected officials' bloated salaries, but it cannot be fixed on the retention of its registered nurses. What care has a county commissioner provided to a patient of the community? In fact, what decision has a county commissioner made that didn't jeopardize patient care? Commissioner Stanley Moore, who recently paid a disruptive visit to our county hospital, told the Tribune that it's unfair to people who want to do this job and commit full-time efforts to their community. How do the county commissioners, the county board president, the sheriff, the assessor, the clerk, treasurer, circuit court clerk, and 3 members of the Board of Review commit more of their efforts to the community than registered nurses, social workers, surgical technicians, food service workers, therapists, chaplains, transporters, sterile processors, community health workers, sanitation service workers, environmental service workers, teachers, state's attorneys, and chief judges? How do county elected officials justify giving perpetual wage increases to themselves and employees operating strictly within the revenue generation and collection arms of government more than the employees who actually provide the services to the communities that you all allegedly represent? How is a phone call to a commissioner more useful to Cook County Health patients than a phone call to a registered nurse? It isn't the answer. What will happen when the only people left to call are politicians because the nurses left after years of abuse and neglect? The most common infraction in labor at Cook County is the allegation of negligence in the performance of duties. Today, we allege this with evidence against the Cook County government and this board meant to hold them accountable on behalf of its healthcare workers. County RNs demand retention bonuses and other forms of compensation that will make working for our hospital competitive enough to not shut its doors or kill its patients due to your further negligence.
The next testimony is from NNOC registered nurse leaders.
This testimony is submitted by registered nurse leaders of the National Nurses Organizing Committee at Cook County Health and Hospital System. Since June of 2021, Cook County has aggressively dismissed and violated the promises it made to staff nurses throughout the pandemic. It is both embarrassing and frightening that Cook County cannot meet its financial commitments to owed wages. For nearly a year, we nurses have been waiting to receive increases to our compensation that the Cook County Board of Commissioners agreed to and ratified by vote. In the same period of failure to implement the gains owed to us, CCHHS has unilaterally reduced earned benefit and hourly rates multiple times. They are stealing money we nurses have earned. These practices highlight the exact reasons your nursing talent is leaving for other hospital systems and agency employment. You are allowing the nursing shortage created by your long-term inadequate staffing practices to be aggressively amplified by those refusals to pay nurses competently what we are owed. In addition, you all are making it impossible to understand how many permanent nurses still work at CCHHS by refusing to provide accurate reports on hiring and vacancies. NNOC RNs demand better than this. Cook County taxpayers deserve better than this. Cook County Health and Hospital System patients deserve better than this. We would like to provide meaningful context to the situation your nurses are truly in. There has been talk of the nursing shortage for over a decade. The last year has been the worst the nursing profession has ever seen. The hospital has told us that this is due to record levels of nurses retiring, possibly due to COVID-19 and increased levels of violence toward healthcare workers, and not enough teachers to churn out new graduates. But according to the 2017 U.S. Department of Health and Human Services report on supply and demand of the nursing workforce from 2014 to 2030, there are enough nurses to meet the demand in most states, some with a surplus of which Illinois was included. In fact, Illinois is projected to have a 2.6 surplus of registered nurses in supply by 2030. So if there is in fact a surplus of nurses, why is CCHHS pushing the rhetoric that there is a nursing shortage and not enough nurses willing to stay in direct care? Consider our county RN insight further. It is a known hospital practice to understaff RNs on every shift in all units possible. Why? Because nursing service is included in the price of the hospital room. Unlike physicians who can bill separately for their services, if admitted to a general care bed, your nurse may have 5 patients or she could have 9 patients, but the room and board bill will be the same for each patient, no matter how many patients the nurse has. Therefore, it's more profitable or budget friendly to have fewer nurses taking care of more patients. For this reason, county hospital practices bare bone staffing. When COVID-19 hit and there was a surge in admissions, many temporary nurse positions started appearing through temporary staffing agencies because we could not meet the staffing demands for the influx of COVID patients. These temporary RN positions pay 3 to 4 times what permanent county staff nurses make because demand has been so high. Temporary nurses are somewhat akin to a substitute teacher. They are used as a supplement when hospital staffing is not adequate. They receive little in hospital training, approximately 4 to 8 hours, and are expected to jump in and take patients, and permanent staff are expected to help them acclimate. As you can imagine, county nurses have felt insulted the entire pandemic. Our hospital that we've been loyal to, many of us for decades, is now expecting us to mentor new batches of temporary nurses every 8 to 12 weeks, on top of carrying our own elevated patient loads, all while these temporary nurses are making 3 to 4 times our rates. Many county nurses decided to leave their long-time positions for temporary positions. At John H. Stroger, JHS, we lost upward of 100 nurses that went to pursue these positions. As a quick fix for this mass exodus, you all started hiring temporary RNs. Many units are currently staffed with 50 to 75% temporary RNs. Some days the percentage is higher. Why does this matter? Temporary nurses are also trained RNs, are they not? As long as nurse-patient ratios remain decent, patients should still receive proper care, correct? The answer is not that simple. County RNs are evidence-based researchers and medical professionals. We know that the evidence around temporary staffing of RNs is mixed. Some studies found increased patient falls and decreased quality of care, while others found no differences, which means that there is probably another confounding factor. We believe it isn't that temporary RNs are bad nurses, but that the percentage of temporary workers per unit is far too high. Temporary RNs are less familiar with unit layout, policy and procedures, which is not a hindrance if you have a decent number of permanent staff, say 75% or more, because then the temporary RNs have resources they can rely upon to point them in the right direction. When permanent county nurses are scarce, temporary workers have just to do the best they can do with no one to guide them, which can lead to increased patient complaints, decreased patient satisfaction, and more drug errors. A study by Senek et al. Found that an increase in the proportion of temporary staff significantly increased the amount of care left undone. It also concluded that fully staffed shifts with a large amount of temporary RN staff had the same amount of care left undone as a severely understaffed shift with no temporary workers. Care left undone has been associated with poor patient outcomes and increased mortality. We found another study showing high levels of temporary RN staff resulted in a substantial increase for hazard of death, while temporary staffing at low levels had no increase. In spite of these facts, county solution to our nursing staffing issues is to hire more temporary staff and to refuse to offer retention benefits to current permanent staff. Hence, more permanent staff will be leaving. Surrounding hospitals have offered their current staff retention benefits, such as wage increases, bonuses for extra shifts, and lump sum retention bonuses, but county has done nothing. The county system is a safety net hospital for all of Cook County, meaning we nurses take care of everyone regardless of their insurance status and their ability to pay. That means that the taxpayer supports the hospital. A study conducted right here in Illinois by Laster et al. Found that if medical surgical units staffed with a 4-to-1 patient to nurse ratio, it could be as high as 7 or 8 to 1 exposure. During the 1-year study period, more than 1,595 deaths would have been avoided, and hospitals would have collectively saved over $117 million. Spending more money on permanent nursing staff actually saves money in the long run. County investing in its current nurses through retention benefits and increasing wages to make positions more desirable in hiring will be more beneficial to the hospital than padding staffing with temporary RNs, because it will improve patient outcomes, which has been shown to save money. Additionally, even offering retention benefits and raising wages somewhat would be less expensive than hiring temporary workers at 3 to 4 times the rate of permanent staff. CCHS's behavior towards its nurses indicates a complete devaluation of the permanent staff that have remained loyal and believe in our mission of quality care, regardless of insurance status. It also indicates that your hospital board does not really care about improving patient outcomes. There is not a nursing shortage, just a shortage of nurses willing to work in hospitals that force nurses to risk their licenses by working in unsafe conditions for substandard pay. NNOC RNs demand that the CCHHS Board of Directors provide retention bonuses, pandemic-related differentials and bonuses, outstanding settlements on pandemic-related nursing assignments that violated the NNOC contract, full implementation of wage and benefit increases without engaging in simultaneous wage theft, accurate reports of permanent nurse staff vacancies and hires, respect and dignity. County nurses' loyalty to both the profession of nursing and the county's patients demand nothing less. This is not how heroes are meant to be treated.
And that concludes the testimony for today.
Thank you very much, Madam Secretary. We'd like to acknowledge that the board would like to acknowledge that we know that the staff and the executive team are working diligently to resolve many of the issues raised in the testimony. Next on the agenda are the board and committee reports. The minutes of the April 29th board meeting are being presented for review and approval. Approval will take place in the combined motion later in the meeting. Are there any corrections or revisions needed to be made to the minutes? Hearing none. Next, Director Ketting will review the HR committee meeting minutes.
Thank you. You have the minutes in your package, and I recommend them to you. The Human Resources Committee met on Thursday, May 19th at 11:30 a.m. And the next regular meeting of the committee will be on Thursday, August 18th, 2002 at 12 p.m. We're not going to re-review the material that was presented at the committee meeting. It's enclosed in your package, and Valerie Amos is here if any of you have any questions about that. Suffice it to say, she and her team presented a lot of information about the challenges that we're facing, both in hiring new staff and retaining existing staff, as well as the many initiatives that are underway to address that. There was one action item, which was the approval of a collective bargaining unit agreement with an economic package, wage increases, and healthcare between the County of Cook and the International Brotherhood of Teamsters Local 743, which represents Provident Hospital employees. This was fully reviewed by the committee in its closed session, and we won't discuss here, but we can discuss in the closed session if there are questions or issues. If there are no questions or issues, then by reason of its incorporation into the minutes in this meeting, if we accept the minutes in the combined motion, then we will have approved the action. If there are questions that need to be discussed, we will take them up in the closed session and then come back and approve the CBA. So I ask the board, are there any questions about this agreement that we need to discuss later? Okay. If not, then this will become part of the combined motion when we consider the minutes of the Human Resources Committee. And that concludes the HR report.
Thank you very much, Director Kenny. We appreciate it. Next, Director Munar will review the Managed Care Committee metrics with Aaron Galiner, Interim CEO of Health Plan Services. That committee did not meet this month, so those metrics are being presented directly to the board.
Thank you, Chair. I'll turn it over to Mr. Galiner to present the monthly metrics.
Good morning, directors. Aaron Galiner, Interim CEO of Health Plan Services. We'll start with our usual metrics on membership today. We're continuing to see growth within the health plan. Give Deb a second to catch up. Up to about 434,000 members through May. The next slide shows the overall managed Medicaid market. This data is through February, which is the most recent published data from the state. So our market share continued to increase another 0.1% to 32.5% overall. The rest of the market has remained relatively steady. The next slide shows our growth compared to the overall Cook County Medicaid managed care market. One point I want to call out here is that you can see the overall Cook County Medicaid managed care market decreased for the first time in quite a while. County Care continued to see growth, although it was more moderate during this past month. So over the past 12 months, the overall market's increased about 5% compared to our growth of about 9% during that same time period. The next slide shows our membership compared to the budget. You can see the consistent growth in the red bars. As you know, we assumed in our budget the public health emergency would end and redeterminations would begin at the beginning of this year. The public health emergency has continued to be extended, so we are continuing to see growth in our membership. The 60-day notice period that CMS is committed to give states about the end of the public health emergency has passed for the next quarter, so we are expecting that the public health emergency will be extended again in July, and redeterminations therefore won't start until at least October. The next slide shows our operating metrics, which continue to perform well within our SLAs. And then the next slide shows Our inpatient admissions, red bar is prior period, blue bars are current period, and the light blue shading is projections. We have seen some increase in the recent months, at least based on our projections. So that is a trend we're monitoring, but overall we continue to be lower than the prior year period. The next slide shows our total vaccination rates. These have 55% of members with at least one dose, just shy of 56%. We have seen the increase in vaccination rate here start to moderate. We were seeing this pretty consistently grow about a couple percentage points each period, but seems to have leveled off recently. So we're in the process right now of going back through what initiatives we have underway and seeing if we can tweak any of our campaigns and outreach to try to ensure this rate continues to increase.
Mr. Galina, just a quick question on the vaccination rate. Are we able to track those who are eligible and receiving a booster?
Yes, we do, and we can add that information to the slide if that would be helpful.
Thank you.
Yeah, this is something we just absolutely need to keep working on, particularly as we're seeing the overall rates continue to increase again. I know it's difficult, but it's just something we have to keep on because the evidence is so strong that this is good for the health of our clients.
Very much, Director Kenning. Ms. Galina, could we go back one slide? I did have a question about the inpatient admits. You indicated that we're starting to see potentially forecasting that trend upward. Do we know what maybe is driving that?
Yeah, it's still a little bit early to have a clear answer to that, since most of what we have in there right now is projections based on our authorization data and information from our actuaries. So we're going to be monitoring that as we get some of the claims data. And we have seen an increase coming back, especially in outpatient hospital activity. And part of that may just be some of the pent-up demand that's happened, and that may be leading downstream to eventual surgeries and other admissions coming out of that. As some of the specialty activity comes back.
Okay, helpful. Thank you.
The next slide, Deb, if you go forward one more, shows our claims payment activity. We've been maintaining right around the 30-day mark for the past several weeks, and expect that to continue to be right at that level, if not a little bit lower, as we continue to try to expedite payments. And then the next slide shows the aging based on 30, 60, and 90-day categories, and you can see similar trends there as the over 60 and 90-day categories here are pretty minimal, and you can see the overall decrease that we've been driving on the over 30-day category. And with that, I think that concludes my presentation.
Thank you so much. Any questions from the board? Hearing none, our next scheduled committee meeting will be on Friday, July 22nd at 10:30. There are no motions needed, so the presentation of metrics was for informational purposes only and will be included in your packet. That concludes the Madam Chair report.
Thank you very much, Director Miller. Next, Director Guggenheim will now review the Quality and Patient Safety Committee meeting minutes. Director Guggenheim.
Yes, thank you, Chair. Good morning. The Quality and Patient Safety Committee met on Thursday, the 19th of May at 10:30 a.m. And the next meeting of the committee will be held on the 17th of June at 11 a.m. That's a Friday. The committee received the following reports, which are included in the minutes, which have been circulated for your review. The High Reliability Organizational Dashboard, presented information on the 30-day readmission rate at Stroger Hospital, on the case mix index for medical and surgical DRGs at Stroger, the top box score recommending the hospital, and the data on the diabetes population in ambulatory care. There was also a report on regulatory and accreditation matters. The committee received the executive medical staff reports from both Stroger and Provident Hospital, and the medical staff appointments, reappointments, and changes for both Stroger and Provident were presented for approval. There was also one more clinical training affiliation agreement that was reviewed by Dr. O'Brien, the chair of Department of Professional Education. The committee did go into closed session to review patient safety information, but we're not going to re-review that information today. So the minutes which have been circulated are presented for the board's consideration as part of the combined motion to be made later in this meeting. Unless there are any questions on the minutes or on the other information provided, that concludes my report.
Thank you very much, Director Guggenheim. In Director Ryder's absence, I will now review the Finance Committee meeting minutes. The Finance Committee met on Thursday, May 19th at 9 a.m. The next meeting of the committee will be held on Friday, June 17th at 9:30 a.m. The committee considered the following action items, which are included in the minutes. Conditionally approved 23 contracts and procurement items, number 6, number 12, number 15, 19, 20, and 21 are pending review by contract compliance. On the screen, you will see the contractual requests from the Finance Committee whose fiscal impact are greater than $1 million, which are highlighted for your information. The committee held a discussion during the meeting. The committee held a discussion regarding sole source contracts in general. It was noted that Deloitte is currently being onboarded to help restructure the procurement department and streamline the process. The plan is to have a briefing in the future on the process and the progress anticipated on this matter. During a discussion regarding the MHNU contract, it was noted that the purpose of this extension is to allow for time to go through the RFP process for this service. Extending this contract to January 31st, 2023 should allow enough time to go through the RFP process without the need for additional extensions. During this discussion regarding the Res Publica contract, it was noted that the MWBE goals are set at a full goal of 35% participation. The higher contract amount is due to receiving considerably more marketing services. A request was made for a report to be provided at the end of the year with metrics, and a concern was noted by Director Story regarding approving a 3-year contract without any definitive metrics at the front end that the board has reviewed. The committee also received the following reports, which are included in the minutes. Minority and Women-Owned Business Enterprise Report. 6 emergency purchases were reported. A report of the March 2022 year-to-date financials. The action items, reports, and presentations from the committee are included in the minutes. If there are no other questions on the information, the minutes are presented for the board's consideration as part of the combined motion to be made later in the meeting. I will pause. Any questions? Hearing none. There are no contracts being presented directly to the board for its consideration, so we'll move on to the next agenda item. The next item is a fiscal 23 to fiscal 25, fiscal year 2023 and fiscal year 2025 strategic plan, which is presented for the board's consideration today. It will be reviewed by Mr. Rocha and Ms. Andrea Gibson, Chief Strategy Officer.
Hi, good morning, members of the board. This is now the a few of the presentations that we have had and wanted to just, present forward and bring forward for passage today. I'll introduce and then recognize Andrea to walk through just some quick points. Is before you is our strategic plan for the next 3 years as required by our ordinance. We, as have discussed before, took community groups, community inputs, employee inputs, met with the board on several occasions, and we have reflected the board's comments, reviews, and updates to the plan as over that we have discussed in the last few sessions. And one of those changes also that we wanted to make sure we brought back is new this year is the inclusion of our values, which is an ICARE, and that stands for Innovation, Compassion, Accountability, Respect, Excellence, and Education. And so as you turn to the page where it says mission, vision, and values, we've had 2 prior meetings on the updates to our mission and vision. The mission under this strategic plan will be updated to say, establish universal access to the world's best care and health services for all Cook County residents, regardless of their ability to pay, so all may live their healthiest life. The vision is to ensure health as a human right, and then we have our values that are laid there. That will be updated in our new strategic plan, and that is, again, with great feedback, support, and input from our community and from the board. I'm going to now turn over to Andrea to just quickly review our strategic pillars, and then we'll have any questions, and hopefully we can secure your support of our 3-year strategic plan. Thank you so much.
Good morning, directors. This is Andrea Gibson, Chief Strategy Officer. So as a reminder, we started this process really in February with a variety of stakeholder meetings, including with the community, with employees, with labor, with the County Board of Commissioners, and brought that back to you in March. We did a survey as well, both employee and community, and distilled some of the information from that process. We presented a draft to this board in April and did receive some important feedback that we have folded in. As a reminder, we now will, as an organization, engage in the budgeting process for 2023 and reflect what is in the strategic plan in that budget, and come back to you in August with the budget, with a 3-year financial forecast that will be folded into the strategic plan. Once the budget and the 3-year financial outlook are complete, that will be submitted to the county board in September, in tandem with the CCH budget. And the strategic plan does go to the county board for a vote in October. So just to highlight some of the key changes since this was last presented to you, as Israel mentioned, the vision was updated to say to ensure health as human right rather than health care. Also, we moved up the health equity pillar to be second after the quality pillar to emphasize the higher priority. We shifted more, we had some employee related key results that really should have been reflected in workforce, talent, and teams. And so based on that feedback, we moved that there. We also added a key result about making programs and services accessible to people with disabilities based on feedback. Another key result that we added was around trauma-informed care and services, and ensuring that we integrate that into our practices. We've also, there were a number of editorial updates that I won't run through. I will mention that we added different years on the data tables to include 2019 and 2020 data in addition to 21. So as far as our next steps, for implementation of the strategic plan. You know, upon passage, we would then start work on developing our more detailed work plans for each strategy, integrate them into the 2023 budget, and do the 3-year forecast. So with that, I'll end my review and see if there are any questions. Chair Taylor, hearing none, I'll turn it back over to you. I think you're muted.
It's Friday. Thank you. Thank you very much. Appreciate the review. If there are no other questions before the board takes action on the minutes, action items contained within the minutes and the strategic plan, we can move on to the combined motion. Are there any questions before we move on? Thank you. I'd like to entertain the following combined motion to approve the following. Item 5A, April 29th board meeting minutes. Item 5B, May 19th Human Resources Committee meeting minutes. Item 5D, May 19th meeting of the Quality and Patient Safety Committee meeting, which include the Stroger and Provident medical staff appointments, reappointments, changes, and proposed clinical training affiliation agreement. Item 5E, May 19th meeting minutes of the Finance Committee meeting, which include the contracts and procurement items. And item 6A, the fiscal year 2023 to fiscal year 2025 strategic plan. Do I have a motion?
So moved.
Second.
Thank you. The combined motion has been made and seconded. Madam Secretary, please take roll call vote on the combined motion.
Roll call vote on the combined motion. Aye or nay. Director Curry is absent. Vice Chair Deere is absent. Director Garza?
Yes, I'd like to recuse myself from items 7 involving Chrysalis as it relates to the contract portion, and then item 11 out of an abundance of caution. I'm recusing myself from any discussions or votes related to the county's business with MHNU. Although I have no interest in MHNU, however, the ACO of which St. Martha's is a part owner contracts with MHNU for the support services and want to remove the ability for anyone to perceive or communicate a potential conflict. And I approve the rest of the items. Thank you.
Thank you. Director Guggenheim?
Yay.
Director Harrington?
Aye.
Director Kim?
Aye.
Director Keding?
Aye.
Director Munar?
Aye.
Director Prendergast is absent. Director Ryder is absent. Director Story? Director Story? Director Story, are you present?
He looks to be muted.
And I see he appears present, but he may have stepped away. And Chair Taylor.
Aye.
So you have 7 yays and 5 absent.
Thank you. The ayes have it. The combined motion carries. Next item is my report, which will be brief. I'd just like to commend all the staff, particularly Andrea Gibson and others who worked very diligently on the strategic plan, the 3-year strategic plan, which we approved today. It was thorough. I think the engagement was with both the board, the staff, the community, and input was very good. So thank you. We just like to commend you for that. And we think we have a very good framework in which to deliver quality care to our community over the next 3 years. The next is a report from the CEO, Mr. Rocha.
Hi, good morning, members of the board. Happy to be with you again. Just will be reviewing our divisional reports as part of our report this morning, but did want to remind we have a full submission of the report to the board. Included in that submission is also that was asked in one of our subcommittee meetings was metrics and highlights on our media dashboard and placement and updates on our ongoing campaigns and brand management, and that is included in the report as well as the monthly feature. Today in our divisional reports, wanted to go over each of our some updates on each of our main operating divisions. So we'll start with our ambulatory care division. In April 22, we marked our 1 millionth vaccine dose at the North Riverside Health Center. We have completed 18 pop-up events and gave a total of 453 vaccines. That included first doses, second doses, boosters, and second boosters. That was done in pop-up events and across our community-based clinics. Under our financial highlights, we will start reporting to you to let us know how we're doing to budget baseline. As we started the year in January, due to COVID, both in December and January, we were slightly behind our visits. As COVID visits tricked up, we fell a little behind on our targeted for our budget. That has then been right-sized, and we are starting to close in on our targets. In primary care in April 2022, we are still behind our monthly target by 2,595 visits. This month in April, we had over 72,007 visits. In April 22, we are above budget on our specialty care visits by 671 visits for this month, totaling 30,799 visits in FY 2022. We are still behind budget for the year by 9,287, but are trending in the right projection and hope to close that by year's end. Our operation highlights and challenges under primary care. We finalize our details to be able to provide hot meals to address food insecurity for families at the Robbins Health Center. Between June 6th and September 2nd, meals will be offered on Monday, Tuesday, and Thursdays. For diabetes A1C greater than 9, as an organization, we are already in the top 10 percentile compared to other organizations, meaning we're able to control the diabetic measures for our patients, which is one of our gold standards that we're aiming to hit. We are targeting to control at the top 5% level, and we want to make sure that we continue our growth and improvement in those areas. For specialty care, our volumes continue to trend in the right direction as we are focusing an initiative on scrubbing our schedules to reflect our true volume and productivity benchmarks, and we are opening a TB clinic at our Arlington Heights Health Center. For Healthy Families, after Q3, Healthy Families Initiative has 18 families enrolled and conducted 66 virtual visits for families on early childhood development topics. Our patient support services, which is an ongoing initiative to create a one access source for people to be able to reach all their specialty in ambulatory care at Cook County Health. So we are converting different centers into one enterprise source connection. Our patient support center now answered 37,300 patient calls with an average answer time of under 60 seconds. This patient support center, of course, includes our merged COVID-19 testing and operations. It also includes that we converted 1,150 like-used walk-in primary care slots into follow-up visits. And then we also have efforts supporting our radiology MRI to be able to increase patient selection of scheduling, improvement, and monitoring.
Director Story, were you
I couldn't hear
disconnected?
Sorry, was there a question?
Director Story?
I can hear you now, Deb.
I'm sorry, we can't hear you, Director. What was that?
I apologize.
All right.
Having technical difficulty. I couldn't hear, Kevin, I couldn't hear.
We'll have, we can hear you, Director. We're going to have Deb reach out and see if we can improve the connection, and we'll come back for a question. On our community vaccination program, we completed our 18 pop-up events, vaccinating 303 people in community-based clinics as part of our overall 4,453 that were done for this year. On our infectious diseases and HIV/AIDS care, we are proud to announce that at CORE, we opened a new clinic, our COVID long-term clinic, which will serve patients who have been previously treated for COVID, but continue to experience ongoing symptoms of issues related to COVID. Our Cook County HIV integrated program and the CCH expanded hepatitis and FibroScan services to Providence Hospital in combination and partnership with our team at our core center. We also hosted a pre-exposure prophylaxis PrEP provider champion training session for our staff at the Inglewood Health Center and participated in several community outreach across Chicago area and the south suburbs to raise program awareness about the need to be able to engage and select pre-exposure prophylaxis services. Any questions on our ambulatory care division? All right. Next, we will go to our CERMAC services update. Just we continue ongoing patient vaccination efforts from February 2021 through April 2022. 15,871 COVID vaccination doses have been dispensed. Current vaccination rates of active patients housed in the jail are 62.3%. We really want to commend our team for doing that. That is an outstanding effort that our team has done to be able to make sure to educate and inform and work with patients to be vaccinated, having received at least one dose and 55.4% having received 2 doses. Operating highlights and challenges, jail census has decreased due to IDOC accepting patients. Currently housing 183 detainees remanded to custody of IDOC. Any questions on our CERMAC division? All right, hearing none. Our Cook County Department of Public Health continues to do extraordinary work on their COVID-19 response effort. They have done 50,465,000 vaccinations at 1,579 mobile clinics since January 2021. They have done 4,676 in-home vaccinations since January 2021, and 380,320 rapid antigen tests by Now and Health have been distributed to the community through our partnerships in the community. On COVID-19 response rates, we continue to monitor our cases as we have moved from low to medium and continue to monitor how our cases are spreading. We do encourage everyone in the community to take this moment, if you have not, to be vaccinated, wear your mask, wash your hands, and keep your distance. The things that have helped us to make sure we maintain a healthy community during our COVID days is things that we can continue to take into the future. So please take that moment, if you have not had your vaccination, to take this time to get vaccinated, to get your boosters, to wash your hands, wear your mask, and keep your distance. Agency-wide, on April 12th, the Building Healthy Communities request proposal was posted. Funding through the Building Healthy Communities will support ongoing COVID-19 response, resilience, and recovery. It aims to continue to prevent and control the spread of COVID-19, lessen the health, social, and economic impacts, and reduce COVID-19 disparities. April 12, 2022, information sessions for community-based organizations were held on April 19th and April 20th for suburban Cook County, with attendance of over 90 participants on each call. And so we continue to work on that initiative. We are very excited about this. It's an opportunity for our Cook County Department of Public Health, Cook County government, and Cook County Health to be able to engage with our communities to create some specific strategies to help improve our communities and to help resolve some ongoing issues that have increased social risk factors in our community. Under environmental health, routine inspections, we had 303. Emergency foodborne inspections, we had none. Nuisance complaints that we responded to was 43. COVID mitigation violations received and responded to. COVID tickets was none, and COVID tickets and citations was none. The state of Illinois expanded the cottage food law, which caused an increase in applications that CCDPH received and is in process to respond to. One of the highlights is that their finalized survey instruments of the Cook County Health Survey, Healthy Suburban Cook County Survey, and the Youth Risk Behavioral Survey are finalized. Under lead poisoning and prevention, the HUD grant program began on 9 housing units in April to help address lead poisoning in our county. Financial highlights and challenges, the Cook County Department of Public Health as the management department submitted a year 2 continuing grant in the amount of $3 million as part of the CDC Community Health Workers for COVID-19 Response and Resilient Communities that was awarded to Cook County Health. And looking ahead, the epidemiology unit will launch the Cook County Health Atlas website for the public by the end of May. They will be able to empower our community with data and statistics to be able to learn about our health challenges community-wide. Any questions on our Cook County Department of Public Health? Great. Next, we'll just go to health plan services. And between June 2021 and May 2022, County Care saw net growth of over 31,000 members while maintaining service levels for members provided. In March, County Care kicked off an initiative to prepare for the resumption of Medicaid redetermination at the end of the public health emergency. After the end of the public health emergency, approximately 25 members will be up for redetermination each month. We have not had any indication or received any information that the public health emergency will be discontinued at this time. However, County Care continues to prepare in anticipation for this and will likely be extended through mid-October. We could potentially delay Medicaid redetermination and the resumption of redetermination to December 2022. We will keep you updated as we get more information. We also want to just give a quick update on admissions, discharge, and transfer implication in alignment with the Health Family Services implementation of new admission, discharge, and transfer ADT vendor. County Care established a non-cost sharing data agreement in November. This will allow the care management and utilization management teams to access real-time alerts for County Care members, emergency department, and admission activity at the over 200 hospitals and over 500 skilled nursing facilities statewide. This would give us immediate access when a patient who is impaneled in our community has seeking acute or skilled nursing facility services, so that our care management team can immediately ensure that both their information and services for the patient are continued. We're excited about this development. And our call center highlights in Q1 of 2022, County Care's call center answered 86% of calls within 30 seconds or less and had a less than 3% abandonment rate, exceeding the state's target of 80% within 30 seconds and abandonment rate of less than 5%. Looking ahead, County Care is continuing to implement initiatives to improve its medical loss ratio through medical cost action plan processes and planning. County Care has completed a social risk factors of health plan work plan in alignment with HFS, the most recent contract amendment with Cook County Health, and has submitted plans to Health and Family Services to start implementation strategies to be able to reduce social risk factors of our patients and help resolve issues in our community. Any questions for our health plan services update? Okay. Hearing none, we'll go to an update for Provident Hospital. The Provident ICU opened on Tuesday, April 5th, 2022, and admitted its first patient on April 11th, 2022. Provident Operations and Laboratory Leadership collaborated with Cook County Health Operations, Regulatory, and Laboratory Leadership to prepare for the upcoming CAP survey on May 12th, 2022. Which went very well. Looking ahead, Provident Hospital will be convening a steering committee to coordinate necessary activities to resume ambulance runs, and will resume inpatient hemodialysis services at Provident. Any questions on our Provident update? And last but definitely not least, our update for our Strozier Hospital campus. We just wanted to be able to give some updates on physical capacity. We're closely monitoring global contrast media shortage for radiology. As the board is aware, there has been a worldwide shortage due to interruptions of the production of contrast media from GE in plants that were located in China. A national bolus went out, and the community has, our hospital community has been working with national partners and with our partners across our division to make sure that we are taking steps to closely monitor our contrast media availability. This again is the tool that is used to be able to have high resolution x-rays, and our team has done a spectacular job in ensuring that we have put in measures and processes in place to be able to meet this shortage. We have received information that is hopefully resolving, with some plants that are being brought online in Ireland. And we are in communications with GE and hospital partners across the country. We have ample capacity for inpatients given April COVID declines. Throughput transfer time response is down to half of the prior response time and just above target New dispatch software was rolled out to be able to do this, and we hope to start having the methodology deployed to our housekeeping units next. We reduced a 3-month lead time for outpatient MRI scheduling, making the third next available appointments down to 2 months. Regulatory, we are planning for a stroke survey in May, coordinating with external agencies to conduct annual training exercises in June for a mock mass casualty event preparation across our hospital system and our health system and community and county. Patient satisfaction, we held an additional patient family advisory council to gain additional perspectives about scheduling, experiences, and translator services, and have mapped out strategies to improve on the information that we received. That is our divisional update. And so we are happy to present those to the board along with the full board submitted. Thank you so much.
Thank you very much, Mr. Rocha. The board will now be going into closed session. Action is anticipated to be taken in open session after the closed meeting has adjourned. I'd like to entertain a motion to go into closed meeting pursuant to the following exceptions to the Open Meetings Act, 5 Illinois CS 120/2C 1, 2, 11, 12, and 17. Do I have a motion?
So moved.
Second.
The motion has been made and seconded. Madam Secretary, please take the roll call vote on the motion.
Roll call vote on the motion to go into closed session. Aye or nay. Director Curry is absent. Vice Chair Deere is absent. Director Garza?
Yes, aye.
Director Guggenheim?
Aye.
Director Harrington?
Aye.
Director Kim?
Aye.
Director Ketting?
Aye.
Director Munar?
Aye.
Director Prendergast is absent. Director Ryder is absent. Director Story
Aye.
and Chair Taylor.
Aye.
So you have 8 yeas and 4 absent.
Thank you. The ayes have it. The motion carries. Directors will now go into closed session.